Turning now to a 23 ABC I-Team investigation. Very limited information has been released related to those who have died of COVID-19 in our community, including their ages. County health officials have said releasing that information would violate patients' privacy rights when it comes to their medical information. But 23 ABC has learned the health department could have released that information early on without violating those rights. 23 ABC's Tori Cooper is joining us live from Public Health to break down the legality of releasing that information and where your tax dollars are now being spent to get it. Tori?
Yeah, Jessica, the question here tonight really is whether or not releasing the ages of those who died of COVID-19 to the public would be a violation of HIPAA rights. Well, according to HIPAA statute 164.514, Public Health had two options. They could either scrub through the data themselves, remove all identifying information from the data that is outlined within the statute, or they could hire an expert statistician to examine this data and determine what could legally be released to the public. Well, as you know, Public Health here in East Bakersfield did in fact decide to go with the expert statistician, and tonight we're finding out how this may be impacting your tax dollars. For several months, 23 ABC News has tried to get the Kern County Public Health Department to release data about who is dying from COVID-19 in our community, including age ranges of the patients.
So we know this is something our community is very interested in, and it is some information that we want to get out to our community, but we need to make sure that we do it in a way that protects the rights of the people who have died and the family members of those people.
As of now, the information is still absent from the county's COVID-19 dashboard. Public Health only saying that releasing that information could possibly violate HIPAA laws, and they are working with a statistician to determine if that data can be released. We spoke to attorney Jason Zivin of Sanders Roberts Law Firm in Los Angeles. He tells 23 ABC that the HIPAA statutes allow Public Health to go two ways: to either use the expert designation rule where the county hires an expert statistician to look at the data, or they could use the safe harbor rule where Public Health would have to remove 18 identifying factors.
Name, telephone number, fax number, email address. Additionally, geographic information can only be released within certain boundaries. These boundaries are, they can release the first 3 digits of the zip code of the patient.
Public Health initially appeared to be using the safe harbor method when they released this map in May, showing only the first 3 digits of the zip codes where positive COVID-19 patients were recovering. But then officials announced they decided to retain an expert statistician who granted them the green light to release the full zip code of positive patients. And by doing that,
because we have already released information related to zip code in all of our cases, that affects our ability to release information regarding those deaths.
Hernandez acknowledged during a press conference Thursday that by releasing the full zip code, the county could no longer rely on the safe harbor method to determine if releasing patient data violates HIPAA rights. The county now relying on the paid expert statistician to determine what data can be released next.
So we are continuing to work with that statistician. We do hope to be able to provide more information soon.
Now, 3 separate times I did reach out to Khalid El Imam, who the county says is the statistician who they hired to examine this data, and I did not hear back. We also reached out to the county to find out how much they are paying this statistician, and we did not hear back as of news time. But of course, as we do learn more information about this developing story, we will bring you those details here and on our website, turn223.com. Reporting live in East Bakersfield in front of the Kern County Public Health Department, I'm Tori Cooper for 23 ABC News, connecting you.